My name is Breea Clark. I'm the 60th mayor of Norman, Oklahoma. In our state, vaccine distribution is largely handled by the State Department of Health and funneled through County Department of Health. So cities have often kind of sat back frustrated, thinking, we have all these resources, how can we help? Fortunately, we had an urgent care here in Norman apply to be a vaccine distributor, and he was selected. But he didn't have the space or the staff to fully and quickly disseminate all of the vaccines. And so he reached out asking for, are there resources that the city can share? And we jumped at the opportunity because, like many cities, we have recreation centers that aren't doing a lot of recreation because of COVID-19 and staff that we would love to pay and is ready to work. And so it was a wonderful collaboration between the vaccine distribution pod at a vacant recreation center with helpful staff. Obviously, the vaccines were administered by medical staff from the urgent care, but we helped with entering data, monitoring, for the time after the vaccine, just making sure there aren't any reactions. And we also collaborated with our local health system in case there was any emergency reactions, which we also did not have. So it went very, very smoothly. And again, it was a great collaboration where we both got to meet needs of each other and help people get some vaccinated. Our recreation centers are located all over the city of Norman. And so I think that helps in terms of equity with transportation. Not everyone has a vehicle. So we're hoping to move the pods all over the city of Norman. We're also working on the format for a mobile pod, hopefully collaborating with Meals on Wheels. So lots of collaboration opportunities that will make sure it's an equitable distribution. We've also thought about doing these pods at some of our Hispanic and African American churches to hopefully go where they are and make it a more comfortable setting. Of the pod, which we were able to do, I've also created an email list because the amount of vaccines that we have is ever changing. That has been one of the greatest tools that residents have very much appreciated because they don't have to sit there on social media all day. They will get an email. And I think they're more inclined to have that email alert as opposed to a social media alert. So that's a step that any mayor can take and make sure that you're collaborating with private businesses like the urgent care, finding out who in your community does have the vaccine and just simply asking, how can we help? Looking at what resources you do have. You may not have medical staff, but sometimes you just need bodies to coordinate the lines and enter data and observe. So it was great that our city was on the cutting edge in the state of Oklahoma. We did have other cities call to ask how we did it and to model it. So it shows that we're doing something right.